For me, one of the most important lessons is that the product code used in the European countries is not exactly the same. Some of the countries recognize the GTIN, the Global Trade Item Number, as a product code, and others want to have what we call an NTIN, a specific structure in the code used for their markets, and they even differ from the way they use it. So what you have to do in Austria and what you have to do in France is not exactly the same. So that's one of the most important lessons, I would say. Get knowledge about what is the requirement for each country individual, even though it's the same frame. What is the requirements so you're sure that you make the right solution for the right country.
Yeah, I would say that actually the FMD is a good way of seeing that standard. You know, it's important standard to fit into this regulation. So you know that even though there is differences from one country to another, you still have a standard you have to follow.
I say it like this, that the countries around the world, when we're talking about serialization of pharmaceutical products, are very good at using the GS1 standard for the data carrier, so the GS1 data matrix. But the GS1 standards is a GS1 system of standards, and there are other part of standards which is very relevant to have a data process supporting the use of the data carriers. And we see that there's a lot of countries who have different setups on that, and there they could benefit from looking deeper into the options of the international standards, because often we see the invention of local standards which actually could be covered by the international standards available. What we as a GS1 community always recommend is that internally in your organizations you find your GS1 champions who is responsible for that your production facilities is using the GS1 standard in the correct way. So that's one of the most important lessons to give to others. And also it's important to engage in your local GS1 community. Engage with your local GS1 organization and make a cooperation, and that can be very, very helpful for the pharmaceutical manufacturers to not only have an internal champion but also have a cooperation with the local GS1 organization.
Yeah, and then see, you know, serialization as a process and not just a project, but something's ongoing. I see you can't just say it's challenge or benefits. I think it's both, because of course it's a huge challenge for all the companies going to implement it, but it's also benefits. It's benefit also for the companies, but also for the end users. You can scan a barcode and you not just get the product number, but you also get the batch number, serial number, expiry date. You can use it for example, patient safety.
Yeah, I see serialization as a very, very important tool for how pharmaceutical products are used in the future. It gives the option to individually identify each package, and we will see the use of these standards in the future not only to be compliant to legislative requirements, but also to enhance patient safety, know exactly which vial is in which patient's home, which vial is used in which patient, and so on, to increase the patient safety, not required by law, but just to increase it because it gives patient safety. Let me say it like this, that I'm absolutely sure that pharmaceutical products is not the only product range we will see serialized in the future, because this individual tool is saying that I can identify each instance of a product individually. That can be very helpful also for high-cost luxury products and so on, which we see already today on expensive bags, perfumes, and so on. So it will absolutely be, the concept will spread to not only pharmaceuticals but other range of products as well, of high value and risk of counterfeit.